My name is Julia Vasquez-Gonzalez. I am originally from Colombia, Palmira. I immigrated to Miami, so Miami, Florida is my hometown now, and I'm on my third year of medical school. Morehouse School of Medicine is exemplifying the change that we want to see, the diversity we want to see. When I applied to medical school, I did the great school in Florida. I am so thankful for the opportunities I had at my university, but I listed my medical schools into which one has the most diverse, because that was so important to me. This field is not anymore about gaining money or any of that. It's about you wanting to be a doctor, but the importance is the why. And I wanted to see students like me that really had a big passion, whether it was because you want to lower the Black mortality rate, or whether it was because you want Hispanics to be able to see a physician in their language. And that really drew me into Morehouse. And now I'm able to see these doctors, these professionals that were able to make it. So if they can make it, I can make it. And that was just so incredible to me. And they show all these barriers that they had to break. And they are giving us that opportunities. They were so welcoming into everything. We say Morehouse is a family, but it's not just saying they're a family. They do show you that they're a family. And that was just so important to me. And it's the support that you need when you move away from home and when you're starting this career where you maybe don't have a background. You don't have a sibling or dad or grandpa that did the medical field. This might be just you, and they can show you that. Thinking back, I probably wanted to be a doctor since I was a child. There is a drawing of when I was like 3 years old. I was like 3 years old. I was in kindergarten, and we had that project of what do you want to be when you grow up? And this was back in Colombia. And I said I wanted to be a lotora, it's actually doctora in Spanish. So I think ever since then, at that time I said I wanted to be a pediatrician, and things have come and go. So my older brother, who I love so much, and my mother, they're probably the first ones to know that I wanted to be a doctor. If I could give one advice to a high schooler or any kind of student that wants to become a doctor, I will tell them to ask questions. I will tell them to expose themselves, because it is a really hard field. I think you need to come here with a passion. You need to come here with a calling, because it gets harder and harder, but if you have a calling and a passion for it, you can keep going. But I can tell you this, I can tell everybody these words all the time, but you have to see it for yourself. And a lot of physicians, a lot of other health professionals are very willing to let you shadow. They're very willing to talk to you, and you need to see that. You need to really expose yourself to that. You need to expose yourself of how you communicate, or what things can you better yourself of. And I think that is so important. And if the opportunities are there, you need to take it. You need to say yes. You need to believe in yourself and allow others to believe in you. And I think that is the most important thing if you're thinking of coming to this field, and also informing yourself of all the other fields. I am pursuing my career as a doctor, but you can also pursue yourself a career as a nursing. You can pursue yourself in PA. You can do speech therapy. You can do physical therapy. There's so many spaces for us aside of just being a doctor, but we need that. We need that community, and we need that team so that we can grow and that we can bring that health equity that we're looking so forward to. The thing that brought me to Seattle for this rotation was just a simple opportunity. We were filling out orientation papers, and it was a question for my surgery rotation, do you want to go to Seattle? And I said, sure, why not? I mean, I've lived in Florida, I've lived in Georgia, I've lived in Massachusetts, I've lived in Wisconsin. I think Washington would be such a great opportunity. And my elder sister, she lives here. We have never grown up together, but it was just such a great opportunity to get my career advanced, but also be able to spend time with my sister. Seattle has been really interesting. It has been a complete different experience. Around Seattle, I like the walkability. I'm not able to do that so much at home. The first thing I gave myself a goal was to get a bus card, actually. And I got the bus card, and I was able to see so many other things. Just the public market, it's its own little mystery, it's its own little history, and I love that. There's a combination, even within the architecture, there's a combination of modern and yet historical, and I really love that. I seen some part of my community, and I was able to hang out with a Colombian friend, and we went out dancing. And then there's peaks and spots, kind of like this hidden holes, and I love that. It's just so interesting, especially as like I think a young person, just being able to do that and feel safe. So far, you of course take care of yourself, but I feel okay walking around and exploring digest for myself. My experience with the rotation has been really incredible. I love how hands-on at Virginia Mason they have been. I got assigned with a 4th-year resident. If you're not a medical student, you're not usually with a 4th-year resident, you're with an intern, but everybody was just so welcoming. And as soon as I came in, he told me, oh, you're with me. And I said, okay, cool. I'm just gonna go around with you. And that first day, I remember I saw the attending. He was really welcoming in the OR. There's just such a different culture here where they know each other. The attending knows the anesthesiologist, they know the surgical tech. And I love that. That really stood out to me, just how welcoming everybody was, but also just having that connection made it so much easier for everything to flow together. They kind of were able to follow their steps, which is so efficient and important in medicine. If you know your team, you know how they work, you're able to just move so efficiently, and it really shows in patient care and the patient outcomes, because our patients are able to just go home the next day or go home that same day without complications. I would say to other Morehouse School of Medicine, consider a rotation in Seattle. I would say to do it. I would say because A, it's been fun. B, they have given me the opportunity to grow and they have exposed me to so many other things. But C, I think it is a growth as a person. We are thinking right now, not just as a medical student, because a medical student is gonna be just 4 years. But if you think about it, as you grow in a person and you go and see other sides, you also see what's missing here. Where can I maybe see myself? Or what opportunities can I open up myself in other sides? And I think this shows you, I would probably, if you asked me a year ago if I would be here, I would have said, oh no, Washington, why would I be in Washington? But it's just really incredible, and you need to open up those opportunities for yourself, and you need to take them when they're there, because now they're there and that's incredible. But we need to take those opportunities, because as we take those opportunities, more will come where we will see ourselves in other spaces, and we can open up those spaces not just for ourselves, but in the future for the future medical students that can come. I believe it's important for others to invest and support the mission that Morehouse School of Medicine and MiCA have in this region of Seattle, because of health equity. Just why not? It's not going to hurt nobody. It is just showing and inclusive. It's just bringing everybody together. We are communities that are not going anywhere. We're communities that have been here for so many years, and we need that representation. We need that cultural sensitivity. We need those experiences to be shown there, and we have the capabilities. Nobody should question whether an African American, whether a Hispanic, whether an immigrant can do this, because we can do this, and we have the power to show it. We have the numbers to show it. I am here showing it. My classmates are here showing it. And that's the importance of this mission, is that we can do it. If you bring us these opportunities, if you bring us here, we can show you the difference that we can make. And you won't be asking yourself, what if, but you'll be asking, like, how much did we change? So far, I said that the area of medicine that I was drawn to the most is cardiology, because cardiovascular diseases are the #1 killer in Hispanic communities. Myself being in Hispanic communities and Black communities and just minorities overall, it's just so affects everybody in so many different ways. I lost my grandmother when she was 42 from an aneurysm. I lost my grandfather from aneurysm. All my family actually has cardiovascular problems, so it's such a passionate topic to me. But it's really funny though, because this rotation has kind of shown me this side of surgery. And while surgery has been male dominated for so many years, I was talking to this one attending, and it shows the difference of when you actually talk to people in the field. And she told me, you know what's funny? It's that while men have been leading the surgical field, surgery is all about using your hands. Yet in history, women have been the ones doing the arts and craft. We're the one doing the details. We're the one doing the sewing. So it just shows that if we're able to transfer those skills into surgery and to medicine, there's a spot here for us. So maybe I will end up doing general surgery. Morehouse School of Medicine has provided me examples. They have provided me inspiration. They have provided me guidance. I am so thankful for my counselor. I would love to tell Dr. Wimes, thank you for being there with me. They really do check up on you and they take you in. Morehouse has also given me inspiration within my classmates. These people are just so passionate. I have friends that said they wanted to do neurosurgery from the beginning because there's no neurosurgeons really in their community. A person that wants to see Black maternal health, and I see her in her community. I see her in volunteering events. I see her doing research, and that inspires me to keep going. You feel very lonely as a student, and that is natural to come. But when you have people that inspire you, that you see that they can reach these levels, it just keeps you going, and it tells you if they can do it, I can do it. And that's been crucial for me. And also being part of the change. We see our school growing so much. We see them now. Morehouse School of Medicine is a staple. It has a name and it has this legacy and representation, and that is incredible to be a part of. And that in the future, I see myself maybe coming back, maybe being a professor there, and it's somewhere where I will feel welcome, and that is just incredible to look forward to. Health equity and health justice mean to me that everybody gets an opportunity, that we get to the goal, but we get to the goal with the right resources and with the right steps. It means that my mother's able to go to a doctor, and that there's going to be somebody that understands her experience, that I wouldn't have to be there translating. That's what I had when I immigrated to this country. And even though I'm from a population in Miami that mostly speaks Spanish, I found myself having to do that a lot, having to be there and advocating for my mother. It means that my patients won't be waiting till the very, very last minute to see the care. I worked in the COVID unit as a nurse technician before I became a medical student, and I saw that so many patients that we could have helped, so many patients that we could have saved if they had come. And the reason why was because they were afraid to come. They didn't know the resources they had. And that is the importance of health equity, is that people are not afraid to seek care. And we will see those numbers because COVID was something that happened, but in the future, there's going to be so many more challenges. But we can battle that with health equity because our population is diverse. We have more than 50% of the United States is just now combined. And we need to also give that number of physicians or even healthcare workers. And that is the importance of health equity. For anybody thinking of supporting Morehouse School of Medicine and MiCA's goal and to the impact of health diversity and health equity, and just us as students, I would like them to see how they want their future to look at. How would you want the next 50 years of medicine be? Do you want us to be asking the same questions of what if we had diversified? What if we had provided the space to these students? And rather than asking ourselves, what if, we were going to look at how did it look so different? How did we tackle these challenges? Because we gave that space to students at the time we could have. I encourage you to take a leap on us because we're not going to disappoint you. Our communities won't disappoint you, and our communities need it. The numbers are there. The questions are there. We need this kind of support, and we are there. We are so willing to come and see. I came here without ever being in Washington, without ever being in Seattle, with not knowing anybody really, just my sister and I. But I think we can take those opportunities. We're willing to speak on it. We're willing to speak on our experiences. And we're here, and we need just people to trust us, and we need the resources, and we need that exposure. Why do I want to be in medicine? I think that's the question that keeps you going every single day. And if I had to say that, I would say my community. Growing up in a Hispanic community and not seeing that example, but I had my mom. I had my mom every day telling me, si otros puedes, tú también. If anybody else can do it, then you can too as well. And I had that support, and that's the things that we need the most in our communities. I do not want another challenge or another epidemic, pandemic to pass and have to see my community suffer, have to see my community of Hispanics not being able to communicate with their doctors of what were their needs, not being able to communicate with their families. And I think that's what keeps me going, is that if I can come here, if I can become a doctor, if I can pursue the field, then I can also bring on other students. If they need my help, then they're gonna be able to come to me and ask. I want people to be able to look at me and ask me questions. I want them to just see that if I can do it, others can do it. Just the support I got from my mom, I want others to see that support in myself. I want to see a change in my community. I know that my friends and we want to see that change, and that's really what keeps me going. I've made it this far, and it just means that I can continue on going, and I want to continue going. And I think that's just where the future is going to lead, and that keeps me going because I can do it. So if I can do it, others will do it.